Welcome to the Home Healthcare Today show. I'm your host, Dr. Cleamon Moorer. The Home Healthcare Today show is sponsored by Meridian Health Plan in Michigan. Care above all else. It's the month of February, and February is Cancer Prevention Month. According to the CDC, since 1991, more than 4.5 million cancer deaths have been averted in the United States thanks to early detection, better treatments, and reduced smoking. But cancer still claims 1,700 lives every single day, which is why prevention matters more than ever. Today's guests have dedicated their life and their energy and passion to helping to decrease cancer as well as to prevent it. Today we have on our show Jenny Beamer. Jenny is the Senior Executive Director of the American Cancer Society of Michigan. Jenny brings over 23 years of experience to the American Cancer Society. Jenny is a proven leader in connecting teams, building strategy, empowering leaders, and driving mission impact through revenue, partnerships, and collaboration. Jenny earned her degree from Michigan State University. We also have, as a guest today, Dr. Boris Pasche. Dr. Boris Pasche is president and CEO of Barbara Ann Karmanos Cancer Center. He's the chair of the Department of Oncology at Wayne State University School of Medicine. Dr. Pasche is a world-renowned oncologist and cancer researcher with over 30 years of experience, trained at the Karolinska Institute in Sweden, Harvard Medical School, Cornell, and Memorial Sloan Kettering Cancer Center. He specializes in gastrointestinal malignancies and hereditary cancer. He co-invented a TheraBionic P1, which is an FDA-approved device in 2023 that uses tumor-specific radio frequencies to treat advanced liver cancer. And Dr. Pasche has brought that device onto the show today. Dr. Pasche has published over 250 manuscripts. He is the former associate director of JAMA for over a decade. He joined Karmanos in August of 2023 from Wake Forest Baptist Health, where he doubled NCI funding. Welcome, Dr. Pasche, and welcome, Jenny Beamer.
Thank you.
Thank you.
So let's get into this conversation about, cancer and cancer prevention. With the sensitivity of realizing that everyone in the listening and viewing audience has either been impacted directly by cancer or indirectly through someone's diagnosis that may have been a loved one or a family member. So we're taking caution in our conversation as related to prevention, but the aim of the show is to educate and to inform and to inspire some methods and strategies for better addressing and attempting to prevent cancer diagnoses. With that being said, Jenny, this is your life work. Let's go there a little bit. And why? And what's the passion?
Oh, gosh. Yeah. So I have spent the entirety of my career dedicated to really ending cancer as we know it for everyone. During my senior year of college, yes, go green.
Yes. Smart. Okay.
My aunt was sadly diagnosed with cancer, and during that same semester, she passed. And so that really propelled me into learning more about the American Cancer Society, doing some research, and volunteering. And honestly, from there, because I did lose a loved one, that made me passionate to jump in and started volunteering, started interning, and now here we are almost 24 years later.
Yeah, so taking the pain of losing an aunt and turning it into a life passion and a purpose.
Yeah, and all the people I've met along the way, the incredible progress we've made. I mean, it's motivating and keeps me moving.
Absolutely. Thank you for that, Jenny.
Sure.
Dr. Pasche, as we think about Karmanos and your work there since 2023 and the over 30 years that you've dedicated to this profession in particular, how is Michigan and leading Michigan's cancer fight? How are we doing?
I think Michigan has been a leader in the cancer fight for a long time.
Yes.
Karmanos' history is full of major achievement in the field of cancer research. I'll take one well-known example, the Michigan Cancer Foundation, which is the forerunner of Karmanos, was the first institution in the world to create some cancer cell line. And they are very well known around the world, called the MCF. MCF7, for example, is a breast cancer cell line that was derived from a patient in Michigan and which has been used worldwide. There were also several drugs that were developed by Karmanos faculty, AZT, DDI, which were actually AIDS drugs that are used for cancer patients, and they decrease the risk of cancer, and many other achievements throughout the years.
Absolutely. Very good, Dr. Pasche. You know, now Jenny, with that feedback, right, we still understand that we're leading, you know, we're a leading state, but what are we seeing in the communities?
Oh gosh, I mean, you know, like Dr. Pasche said, obviously there's been some incredible work, and we continue to do incredible work. But even just last month, right, we published our 75th Cancer Facts and Figures from the American Cancer Study, which is, you know, really seen as the gold standard as it relates to cancer surveillance research for the U.S. But some of the findings that we see from that is, as it relates to mortality rates, lung cancer will continue to be the leading cause of cancer deaths, not just in the U.S., but here in Michigan. So we see that. On a bright side, we did see some progress. The 5-year survival rates for lung cancer have went from 15% to 27%, which is great. And for 3 out of 4 people who are, you know, diagnosed with advanced stage lung cancer, we're seeing those 5-year survival rates go from 20% to 38% for a regional diagnosis, but then also 2% to 10% for an advanced stage diagnosis. So while it's, you know, still a major problem, we are seeing some progress. So we need people to continue to, don't start smoking if you haven't yet. Quit smoking, you know, reach out to ACS, to other avenues for some cessation, and also get screened if you fit the requirements for screening.
Absolutely, Jenny. Yeah, and Doc, as Jenny was talking about the developments and decreases, but she also mentioned advanced stages, right? The prevention imperative. What do viewers and listeners of the podcast or viewers of the TV show, what do they need to know as related to prevention?
I think, you know, cancer prevention for certain tumor type is very effective and is less effective for others. So as Jenny pointed out, lung cancer is one of those that can be screened for. So there are a lot of studies that have shown that CT scan in patients who have smoked a lot throughout their life can pick up early lesions that are curable, which we didn't have before. And I think that's something we want to emphasize in terms of screening. For individuals who have smoked a lot, also screening for head and neck cancer is something that prevents advanced disease because you can pick it up at an early stage. Colorectal cancer, which is a disease that we have seen rising in incidence over the past 10 years, we have very good screening method. Colonoscopy is the gold standard, but any form of screening is good, even stool tests. So I would strongly emphasize that. And last but not least, especially for men, the PSA test is a lifesaver. It picks up cancers at a stage where you can treat and cure the majority of patients, whereas if you do not use PSA, you frequently find patients with advanced disease that are much more difficult to cure and treat.
Got it, Doc. And Doc, what is the age? As we start to think about screening for a lot of the men out there, what is a good age to start thinking, you know, PSA?
So I think PSA will depend on 2 things. First, do you have a family history of prostate cancer or not? If you do, you certainly want to be screened at least 10 years earlier than any relative that was diagnosed with prostate cancer. In general, I would say for men, the age of 40, 45 will depend on the guidelines you follow, but it's a good age to start.
Absolutely. Okay. Jenny, so there's some barriers out there for some folks. Prevention in action. What is American Cancer Society of Michigan kind of doing to help folks, you know, get over some of these hurdles?
I mean, Well, we're connectors and conveners, right? We collaborate with Karmanos, with all the other health organizations throughout Michigan, federally qualified health centers, to make sure we're focusing on prevention and screening and those conversations. But also, we have, well, actually, it's semi-new to the American Cancer Study, but we have a tool called the ACS Cancer Risk 360.
Okay.
And so it's a health assessment tool that really looks at 4 factors. So your family history, your genetic risk, your, the likelihood of you getting screening, so your actual screening apprehension, and just daily lifestyle factors. So you take this risk assessment. You can take it on your phone or on the computer. And it's going to share with you what your risk factors are. It's also going to provide you with some tools and resources. So what are your action steps that you should actually take?
Love it.
So you can have good conversations with your doctors.
Awesome. Jenny, how do folks access that tool out there?
So it's ACS Cancer Risk 360.cancer.org.
Okay, we're gonna add that domain to the Home Health Care Today Show website.
Good.
And then definitely run it across the screen. Thank you, Doc. As we think about some disparities in our community, right? We understand that a lot of minority populations run higher risk or greater risk. What is the main driver? What are some of the drivers behind the higher propensity of cancer diagnoses?
So some typical risk factor like smoking, which is, for example, in Detroit is higher than several other parts of the country, and also part of Michigan. Lack of exercise it's a risk. Obesity is another risk. So these are some of the major factors in terms of determinant of risk for cancer.
Yes. Okay. So those factors are mitigable. All right. Exercise and not smoking. Prior to commercial, the role of heredity. What are some ways that we could better hedge against heredity? Granted that maybe a parent or a close loved one also was diagnosed with cancer.
So Karmanos is a very large initiative looking at heredity in terms of contributor to the risk of cancer and the outcome of cancer. So Dr. Schwartz and Dr. Bibi Dimmer run a very large project which is really focused on African American in Detroit, trying to understand the role of heredity and how it can be addressed by essentially testing the patient for all genetic markers. And what we know is among African Americans, there are more variants, what we call VUS, variants of unknown significance. So these studies are very important to try to educate us and make us understand better how to manage the risk in the African American population in Detroit.
Absolutely. Wow. Thank you. Thank you so much. Thank you so much, Dr. Pasche and Jenny. We're going to go to a commercial. Please stay tuned. After the commercial, we're going to see a demonstration of Dr. Pasche's invention, the TheraBionic P1, which is FDA approved back in 2023. So stay tuned.
My name is Terrell Thomas, and I have survived cancer, and I'm just living a joyful life. When you first hear the C word, cancer, it may be scary. The great part about my experience is all of the resources that I had and put together the perfect treatment plan. With the right tools, you can make a great picture frame. With the right treatment plan, that's why I'm in it.
Visit karmanos.org/second opinion or call 1-800-KARMANOS.
Welcome back to the Home Health Care Today show. The topic is cancer prevention, and it's National Cancer Prevention Month. In our first half of our episode, we were diving into some really good conversation and discussion with both Dr. Boris Pasche and Jenny Beamer, Jenny of the American Cancer Society of Michigan, and then Dr. Pasche of Karmanos. Let's get back into this. So I promised that we would have like a demonstration into the discussion about Dr. Pasche's, technological advancement, the device, right? The TheraBionic P1, which is FDA approved, right? This device treats liver cancer using tumor-specific subfrequencies A truly groundbreaking approach. Doc, can you explain more about this technology and how it works?
So over the course of the past 20 years, we've discovered that patients with cancer respond to certain frequencies. We measured their pulse pressure, which is essentially the intensity of their pulse. And we found that when you scan frequencies, at certain frequencies, you get an increased pulse that is always the same frequency with patients with the same tumor. So having discovered that, we had a bold hypothesis: could we use these frequencies to treat the cancer? And we started this work more than 20 years ago. And to our surprise, we found that some patients with cancer were indeed having tumor shrinking and living longer. So we embarked on clinical studies in liver cancer. And over the course of the past 20 years, we have treated close to 100 patients with liver cancer and found that about 15% of them had real shrinkage of the tumor, and about 10% of them were living much longer than expected. And we presented this data to the FDA, made substantial discoveries in the lab, finding which receptor on tumor cells sense these frequencies and what pathway activated. And in 2023, the FDA gave us approval for this device, which is now available to all patients with advanced liver cancer in the US.
Groundbreaking, life-changing, Doc. Now, it can't just sit there on the table. How does that work? Let's check it out.
So we deliver this frequency using this spoon. So some people call it the lollipop therapy.
Okay.
And what you do is essentially place the spoon in your mouth, switch on the device, and treat yourself at home in the comfort of your home, watching TV, reading a book, 3 times 1 hour per day. We have found that this mode of delivery yield the results I discussed: 34% increased overall survival, and about 10 to 15% of patients with significant shrinking of the tumor, and without essentially any side effects. The only side effects we have observed so far is slight irritation of the tongue in some patient that had thrush, some problem that many patients with cancer may have, and some fatigue. These are the only side effects that we have seen in a large number of patients. This is approved for patients who have failed 2 lines of therapy or who are not eligible for these therapies. Many patients with poor liver function cannot be treated today with the drugs we have because they may be too toxic for the liver. This device can be used in patients even with failing liver function. We have also at Karmanos now several other clinical trials in other tumor types, in pancreatic cancer, in colon cancer, and in breast cancer.
Okay. Wonderful, wonderful, Doc. Hold that thought. We're going to get back to the clinical trials and the like with such a diverse population of patients in the Metro Detroit area. And congratulations on the invention and all of the progress that it is making, you know, in the lives of individuals who are battling liver cancer, right? Jenny, those individuals battling cancer or attempting to prevent cancer, right, or the progression or advancement of it, they're not alone in their home, right? So if someone is sitting there with, you know, the device or not a device per se, there's family members, there's caregivers, there's a nuclear, you know, family and system, and in some cases even home health care folks that drop into homes. How can we do more for more people?
Oh gosh. Well, you know, I know I'd mentioned it earlier about us being connectors and conveners. I mean, that is a part of our role, right? In addition to being available for cancer patients and caregivers, a loved one, if someone's been diagnosed, they can reach out to the American Cancer Society 24 hours a day, 7 days a week. There is always a cancer information specialist available. So let's say, right, a caregiver needs support or someone they love has been diagnosed. They can call us. Or live chat through cancer.org. There's resources, whether it's the Cancer Survivors Network that also has a caregiver component. You can talk to other caregivers. Whether it's, you know, looking for resources, we look to remove barriers so that people have access to care. One of the top reasons people reach out to us is because they need a ride to treatment. So it seems simple and it is life-changing, right? What's the good of all the fabulous and incredible treatment options we have now if someone can't get there? So it's working together, and again, we work with Karmanos to refer patients who need rides to treatment. It's a volunteer-driven program, so looking for volunteers. So when you say, how can we help? Community raising their hand to say, hey, I have some extra time, I'm in, I can do this.
Absolutely, very good. And our sponsor, Meridian Health Plan in Michigan, supports members with transportation support and assistance, in getting to doctors, as well as providing those screening devices and the like. So very good. Doc, the future is now, but before a lot of medications and treatments and therapies get to the general public, there are some clinical trials. So let's talk a little bit about Karmanos and leading the way with so many clinical trials.
So it's a very good question. Karmanos has been a leader in the field of clinical studies for decades. About more than 50% of all newly approved FDA drugs and devices were tested at Karmanos first. What does this mean? It means for patient, you have the opportunity to get novel technologies for the treatment of cancer ahead of time. And what has been found from many studies is that patients who participate in cancer studies live on average 20% longer than those who don't. Why is that so? Well, it could be two things. First of all, these patients are well screened, but they also followed up much more carefully because they are in studies and they have access to novel technologies, which sometimes are breakthrough. And breakthrough include immunotherapy, breakthrough include theranostics. All these studies are offered at a comprehensive cancer center like Karmanos. Yes. That's why getting a second opinion and looking for other options give many patients more time and more chances to beat cancer.
Absolutely. Wonderful, wonderful. As a home healthcare agency that takes care of homebound individuals, and Detroit being home to about 40,000 folks that, whether it's a debilitating disease or lacking transportation, are deemed homebound. And the state of Michigan has about 100,000 folks overall that are deemed homebound. From the vantage point of American Cancer Society, from the vantage point of Barbara Karmanos, what can we do better for that homebound population that's sometimes overlooked?
Well, I'll jump in and just, I know, in some cases with some cancers, there are some at-home screening options. I know Dr. Pasche talked about colorectal cancer. Obviously, the gold standard is a colonoscopy, but there is an at-home test. So the best test is the one you're going to be able to get.
Amen. That's right. That's right.
So some at-home screening options for different cancers, that we continue to look at. And also, I'll go back to what I feel like I've said multiple times, but using each other as resources and being what a true community is, which is helping each other, right? And so reaching out to people, having conversations, the homebound population.
Yes.
What can we do better? What can we do differently? And just opening up those lines of communication as community members and collaborators.
Certainly. Thank you, Jenny. How about you, Dr. Pasche?
I would echo what Jenny said.
Yes.
The transportation is a major issue.
Yes.
It's a major issue in big cities like Detroit. It's even a bigger issue when you live in rural communities.
Yes. Yes.
Where we see, in general, patients come with later stages of cancer, have had less screening. And I think this is an area where we could do better by providing better transportation, better access to care and screening and treatment for patients who are either homebound or live far away from any facility where they could get screening or treatment.
Wonderful. Okay, so we are also eye care for Detroit, eye care for Michigan. We operate mobile eye care units. We get out there and do vision screenings. In the event that we could partner and do cancer screenings of various sorts, we're open to that opportunity because we're right there in the driveway or right there curbside for folks. Okay, the last question. Calls to action for viewers and listeners, as well as hope. What is hope for the future as we think about cancer prevention? So call to action for folks, and then hope. Yes.
I mean, a call to okay, I'll mix in the call to action
Yep,
and the
yep,
hope, right?
yep.
So, in terms of hope, right, we know cancer mortality rates are on the decline. We have been able to report a 34% reduction in cancer mortality rates, and that is because people are getting screened, or people are driving more people to get screened. We're having these conversations.
Yes, we
so
are. That's right.
progress is happening,
Yep.
right? The 5-year survival rate overall for cancer is 70%. This is new information, new data. That is big. So that only happens because we continue to make sure people know the importance of cancer screenings, early detection, access to care, all of the things we're talking about. So the call to action is, get screened, reach out for resources, connect with each other. The American Cancer Society is here, partners are here, and let's keep talking about it.
Don't hesitate. Fantastic. Thank you, ma'am. Dr. Pasche, call to action as well as hope for the future.
So call to action, I would say screening, health changes. So we talked about physical activity, we talk about obesity, we talk about smoking, and we haven't talked yet about alcohol. But all of these are associated with increased risk of cancer, and we can act upon them. So small things, for example, if you drink rarely and don't drink too much. If you smoke, quit smoking. There is really no good smoking, period. Physical activity, it's everybody's opportunity to think about what can I do. Just walking every day is probably the simplest and best exercise that people can do.
Absolutely.
So I would say we live really in a golden age for oncology, where every 2 to 3 years we have novel options, novel therapies.
Wonderful.
And what used to be a one-way street is no more. So I think this is my message of hope. We are not yet curing all cancer, but we are treating all cancer better and better, and with therapies that are gentler and gentler.
Wonderful. Now that's optimism for you. That was optimism, Metro Detroit viewers. Action as well as steps to lead a healthier lifestyle, to lean more into that area of prevention. And then understanding that a diagnosis per se is not the end. So let's not fear getting screened out there. Grab someone near and dear to you. Make sure that you're following up with your primary care physician as well as a specialist in the event that you need one. Reach out to American Cancer Society. Feel free to reach out to Barbara Karmanos, American Advantage Home Care, or Meridian Health Plan in Michigan, because we are here to support. That's all, folks. Until next week.
Just an individual patient who may have gone from having an uncontrolled A1C and not knowing how to control diet, insulin, and to going through a food as medicine program where they receive the food access, really start to be, preparing healthy meals over time, see that behavior change, see that improvement in health and wellness.